Okay, hi, my name is Patricia Hernández, and this is the reading of the material and exercises from chapters 5 to 13. Okay, so this is the chapter 5, Medical Practitioners 1, and A, Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council's list, or registered in order to practice. A doctor who treats patients as opposed to one who only does research is called a clinician. A doctor who provides primary care for patients is also known as a general practitioner, GP, or family doctor. GPs usually work in a group practice. Larger group practices work in a building called a health center. Ok, practicantes médicos 1 o médicos practicantes 1. Practicantes. En Gran Bretaña, los doctores, también conocidos como practicantes médicos o como practicantes, deben estar calificados, preparados. Eso quiere decir que tienen que tener un título universitario en medicina. Y ellos también deben estar registrados, es decir, incluidos en la lista del Consejo Médico General para poder y registrados para poder practicar. Un doctor que trata a pacientes, por lo contrario de uno que realiza investigaciones, es llamado clínico. Un doctor que provee atención primaria a pacientes es también conocido como doctor general, médico general o doctor de familia. Los doctores generales usualmente trabajan en un grupo de práctica y grupos de prácticas más largos o más grandes trabajan en un edificio llamado centro de salud. B. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the National Health Service providing private health care may have consulting rooms outside a hospital, for example, in the famous Harley Street in London. The two main branches of medicine are surgery and internal medicine, and the doctors who practice these branches are called surgeons and physicians, respectively. In Britain, male surgeons are addressed as Mr. and females as Miss. So Dr. Smith is a physician and Miss Smith is a surgeon. A cardiologist specializes in or is a specialist in diseases of the heart and circulation or cardiology. A geriatrician specializes in or is a specialist in diseases of elderly patients or geriatrics. An anesthetist specializes in or is a specialist in anesthetics. Note, names of specialties usually end in ology. Names of specialists usually end in ologist. If the name of a specialty ends in "ix", the name of the specialist ends in "ishan". There are some exceptions, for example, anesthetics and anesthetists. Ok. Especialistas o especialidades. En los doctores especialistas, por ejemplo, los pediatras, Normalmente trabajan en hospitales. Sin embargo, aquellos que trabajan fuera del Sistema Nacional de Salud, eh, eh, dando una atención de salud privada, pueden trabajar en salas de consulta o en consultorios fuera del hospital. Por ejemplo, en el famoso Harley Street en London. En las dos ramas principales de la medicina son cirugía y medicina interna. Y los doctores que practican estas ramas son llamados cirujanos o doctores, respectivamente. En Gran Bretaña, los hombres cirujanos son llamados o referidos como señor y las mujeres como señorita o señora. Entonces, el doctor Smith es un doctor y señorita Smith es una cirujana o señor Smith es una cirujana. Un cardiólogo se especializa en o es un especialista en enfermedades del corazón y la circulación o cardiología. Un geriátrico se especializa en enfermedades de los pacientes envejecientes o geriátricos y un anestesiólogo, anestesista, se especializa en anestesias. Ok, la nota. El nombre de las especialidades usualmente que terminan en ology, los nombres de los especialistas usualmente terminan en ologist. For example, dermatology, dermatologist. Dermatología, dermatólogo. Si el nombre de la especialidad termina en X, el nombre de la especialidad termina en ISHA. Por ejemplo, for example, pediatrics and pediatrician. Y hay algunas excepciones como anestesiólogo, y anestesista y anestesia. Okay, C, choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide, but I'm quite attracted to the idea of pediatrics because I like working with children. I would certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I have assisted at operations several times, but I've even done some minor operations by myself, even done. But surgeons have to be able to do the same thing again and again without getting bored, like tying off cut arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. Note, the collocation good with is followed by a noun. He's good with children. The collocation good at is followed by the ing form gerund of a verb or by a noun. She's good at explaining procedures and she's good at explanations. Ok, C, escogiendo una especialidad. Jill Matthews se acaba de graduar de la Escuela de Medicina y está hablando sobre su futuro. Yo todavía no me he decidido en qué especializarme. Necesito más tiempo antes de decidirme, pero estoy muy atraída a la idea de pediatría porque me gusta trabajar con niños. Yo ciertamente prefiero trabajar con niños que, digamos, con pacientes envejecientes. Eso quiere decir que no me encantan los geriátricos. Yo nunca estuve muy interesada en la anatomía detallada, lo que eso significa que las especialidades quirúrgicas como neurocirugía no, no, no clasifican para mí. Ya que tú tienes que ser bueno con las manos, lo que no creo que sea un problema para mí, ya que he asistido, he participado, he ayudado en operaciones varias veces e incluso he hecho algunas operaciones menores por mí misma, pero los cirujanos tienen que tener la habilidad de hacer la misma cosa una y otra vez sin aburrirse, como, como atar arterias cortadas y demás. No creo que eso sería un problema para mí, pero ellos tienen que tomar decisiones rápidas y yo no soy muy buena en eso. A mí me gusta tomarme mi tiempo para pensar, lo que significa que las especialidades quirúrgicas probablemente no, es lo no, no sean las correctas para mí. Nota, la colocación bueno con es seguida por un sustantivo. Por ejemplo, él es bueno con los niños y la colocación bueno en es seguida por el gerundio de un verbo o por el sustantivo. Por ejemplo, ella es buena explicando procedimientos o ella es buena con las explicaciones o en las explicaciones. And this is the exercise of this chapter. Okay, 5.1. Write sentences to describe the work of the specialist in each branch of medicine. Okay, number 1, dermatology. A dermatologist specializes in diseases of the skin. Rheumatology. A rheumatologist specializes in diseases of the joints, muscles, and bones. A traumatologist is a specialist in wounds and injuries. A pediatrician specializes in diseases that affect children. An obstetrician is a specialist in managing pregnancies and delivering babies. 5.2. Complete the table with words from A, B, and C, opposite and related forms. Put a stress mark in front of the stress syllable in each word. Okay, specialize, specialist, specialty. Practice, practitioner, practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. Okay, 5.3, find prepositions in C opposite that can be used to make word combinations with the words in the box. Okay, a pathologist specializes in diagnosing disease through examining cells and tissue. A pediatrician must enjoy working with children. An oncologist is interested in the diagnosis and treatment of cancer. A psychiatrist must be good at counseling, and a neurosurgeon must be good with her hands. 5.4, make word combinations using a word from each box. Okay, consulting rooms, general practitioner, group practice, health center, internal medicine, and surgical specialties. Okay, so the chapter number 6 is medical practitioners 2. A, hospital staff. The people who work in any type of workplace, including hospitals, are called the staff. The medical staff in a British hospital belong to one of 4 main groups. Number 1, a pre-registration house officer, or PRHO, or house officer, is a newly graduated doctor in the first year of postgraduate training. After a year, he or she becomes a registered medical practitioner. In the current system of training, the foundation program, the name for these junior doctors is Foundation Year 1 Doctor, FJ1. A senior house officer, SHO, is in the second year of postgraduate training. The title is now Foundation Year 2 Doctor, FJ2. but the old terms senior house officer and SHO are still used. A specialist registrar, SPR, is a doctor who has completed the foundation program and is training in one of the medical specialties. There are also some non-training registrars, doctors who have completed their training but do not wish to specialize yet. And a consultant is a fully qualified specialist. There may also be some associate specialists. Those are senior doctors who do not wish to become consultants. In addition, there is at least one medical or clinical director who is responsible for all of the medical staff. Okay, practicantes médicos. Dos, personal hospitalario. Las personas que trabajan en cualquier lugar de trabajo, incluyendo hospitales, es llamado personal. El personal médico en Gran Bretaña, en los hospitales de Gran Bretaña, pertenece a uno de estos grupos. Preregistrado house officer. Es un doctor recién graduado en el primer día de entrenamiento posgraduación. Después de un año, él o ella se convierte en un médico registrado, en un médico practicante registrado. En el sistema actual de entrenamiento, el Foundation Program, el nombre para este doctor recién graduado es Foundation Year One Doctor. Doctor del primer año del entrenamiento. Un house officer mayor está en el segundo año de su entrenamiento posgraduación. El título ahora es doctor del año 2 del programa, pero los términos viejos, senior house officer, se siguen usando. Un especialista registrado es un doctor que ha completado el programa de entrenamiento y está entrenando en una de las especialidades médicas. También hay algunos registrados no entrenados que son doctores que han completado su entrenamiento pero no desean especializarse todavía. Y un especialista o un consultant es un especialista completamente calificado. También podrían haber otros especialistas asociados que son doctores que no desean especializarse También, en adición, hay por lo menos un director médico que es responsable de todo el personal médico. Medical teams. Consultant physicians and surgeons are responsible for a specific number of patients in the hospital. Each consultant has a team of junior doctors to help care for those patients. In many hospitals, there are multidisciplinary teams which consist not only of doctors, but also of physiotherapists and other allied health professionals. When patients enter or are admitted to hospital, they are usually seen first by one of the junior doctors on the ward where they will receive treatment and care. The junior doctor clerks them. That means that they take their medical history and examines them. Sometime later, the registrar also sees the patients and may order investigations or tests. For example, X-rays or an electrocardiogram. Make a provisional diagnosis and begin treatment. The consultant usually sees the new admissions, people who have recently been admitted to the ward for the first time on one of the regular ward rounds, when the management of the patients is discussed with the registrar. Consultants also decide when a patient is ready to be discharged, sent home. On the ward round, the consultant is accompanied by the team and a nurse, and they visit all the patients in the consultant's care. Shifts. Junior doctors now normally work in shifts, which means they normally work for 8 hours every day. For example, 7 a.m. to 3 p.m. and are then free until 7 a.m. the next day. Until 7 a.m. the next day. After a week, they change to a different shift. For example, 3 p.m. to 11 p.m. or 11 p.m. to 7 a.m. The alternative system is to work from 9 a.m. to 5 p.m. every day and to take turns to be on call. That means available to return to the hospital if necessary, from 5 p.m. to 9 a.m. the next day. Days on call are set out in a rota or list of names and times. Doctors on call carry a radio pager or bleeper, a device which makes a noise when someone is trying to contact them. Ok, equipo médico. Un médico especialista y cirujanos son responsables de un número específico de pacientes en el hospital. Cada especialista tiene un grupo de doctores recién graduados para ayudar con el cuidado de aquellos pacientes. En muchos hospitales hay grupos multidisciplinarios que consisten no solo en doctores, sino también en fisioterapeutas y otros profesionales aliados de la salud. Cuando los pacientes entran o son admitidos al hospital, ellos usualmente son vistos primero por un doctor recién graduado, junior doctor, en la sala donde ellos recibirán tratamiento y cuidado. El doctor los asiste, es decir, que toma su historia médica y los examina. Un tiempo después, el que está estudiando la especialidad también ve a los pacientes y podría ordenar investigaciones y exámenes, por ejemplo, exámenes de rayos X o un electrocardiograma. También un diagnóstico provisional y empezar el tratamiento. El especialista usualmente ve a los nuevos admitidos, que son las personas que recientemente son admitidos en la sala o en la guardia. Por primera vez en uno de los turnos, en uno de las rondas de turno, regulares, cuando el manejo del paciente es discutido con él que está haciendo la especialidad. Los especialistas también deciden cuando un paciente está listo para darlo de alta, mandarlo a casa. En las rondas de turno, el especialista es acompañado por el equipo y la enfermera. Ellos visitan a los pacientes en el cuidado del especialista. Horarios. Los doctores normalmente trabajan en horarios, lo que significa que ellos normalmente trabajan por 8 horas diarias. Por ejemplo, de 7 de la mañana a 3 de la tarde, y luego están libres hasta las 7 de la mañana del siguiente día. Después de una semana, ellos cambian a un horario diferente, por ejemplo, de 3 de la tarde a 11 de la noche o de las 11 de la noche a las 7 de la mañana. El sistema alternativo es trabajar de 9 de la mañana a 5 de la tarde todos los días y tomar turnos para estar en llamada, para hacer llamados. Es decir, estar disponible para regresar al hospital si es necesario, desde las 5 de la tarde a las 9 de la mañana del siguiente día. Los días en los que ellos están preparados para atender llamadas son puestos en una lista con sus nombres y horarios. Los doctores, puestos en llamada, cargan con ellos un bleeper, que es un dispositivo que hace un sonido cuando alguien está tratando de contactarlos. Okay, here are the exercises from this chapter. 6.1. Make word combinations using a word from each box. Associate specialist, house officer, on call, provisional diagnosis, radio pager, and word round. 6.2, match the descriptions with job with the job titles. Number 1, Dr. Graham has been a pediatrician for 8 years and is responsible for treating the children admitted to Ward 16. That means that he is an consultant. Dr. Stewart has just started the second year of her foundation program. That means that he is a senior house officer or SHO. Dr. Sin has started his training as a surgeon. That means he's a specialist registrar. Dr. Phillips has just graduated and is working in a large hospital in Birmingham. He's an PRHO or house officer. And Dr. Miller is in charge of the medical staff in the Birmingham Hospital. And that means a medical director. 6.3. Are the following statements true or false? A medical graduate becomes registered 2 years after graduation. That's false because it is after a year that they become and graduate. The system of training doctors in Britain is called the Foundation Program. That's true. The name senior house officer is no longer used in Britain. That's false because it is still used. The consultant is usually the first doctor to see new patients. That's false because the patients are usually seen first by one of the junior doctors. And number 5, when working in shifts, all doctors take turns to be on call. That's false. 6.4, complete the text of a PRHO describing their job. When I get to the ward, the first thing I do is talk to the house officer who was on duty during the last shift to find out if there have been any new admissions. Then I generally see the charge nurse. He tells me if there is anything that needs to be done urgently, such as intravenous lines to put up or take down. Later in the morning, I clerk any new patients, which basically involves taking a history. On Tuesday and Friday morning, the consultant does her ward round, and I have to make sure I'm completely up to date on her patients. After that, there are usually lots of things to do, like writing up request forms for blood tests, and so on. In the afternoon, I have to prepare for any patients who are to be discharged the next day. They are usually happy to be going home. And then, of course, there are the lectures and tutorials in the foundation program on Monday and Wednesday. Okay, number 7 is nurses. A, nursing grades. Nurses working in a hospital have the following grades. A student nurse, that's a nurse who is still in training. A staff nurse, a nurse who has completed the training course. Charge nurse, a more experienced nurse who is in charge of or responsible for a ward or department. And nurse manager, a nurse who is in charge of several wards. Note, the old term sister is still sometimes used for a female charge nurse. A female nurse manager may be called matron. Dr. James is talking to Sister Watkins. Ok, número 7, enfermeras. Grados de una enfermera o de enfermería. Las enfermeras que trabajan en un hospital tienen los siguientes grados o títulos. Estudiante de medicina es una enfermera que todavía sigue en entrenamiento. Un personal de enfermería Es un enfermero que ya ha completado su curso de entrenamiento. Un enfermero encargado es un enfermero más calificado, con más experiencia, que se encarga de o es responsable de un turno o un departamento, de una sala, un departamento, y un enfermero, manager enfermero, es un enfermero que está a cargo de varias rondas o salas. Nota, el término antiguo, hermana, es todavía utilizado por las mujeres enfermeras encargadas. Una enfermera mujer, manager, puede ser llamada matrona. Por ejemplo, el doctor James está hablando con la hermana Watkins. Ok, B, support workers. The clinical support worker who has done a short course and obtained basic qualifications, and the nursing auxiliary who is usually unqualified, both assist nursing staff. There may also be ward clerks whose duties include making sure patients' notes and information are up to date and answering the telephone. C, specialization. Like doctors, nurses can specialize. A midwife has specialized from the beginning by doing a course in midwifery, the management of pregnancy and childbirth. District nurses visit patients in their homes, and health visitors also work in the community, giving advice on the promotion of health and the prevention of illnesses. Entonces, trabajadores de apoyo. Los trabajadores de apoyo clínico que han hecho un curso corto y han obtenido preparación básica, y los auxiliares de enfermería que usualmente no están calificados, ambos asisten el personal de enfermería. También podrían haber asistentes de turno, de ronda, cuyos trabajos, cuyas tareas incluyen asegurarse de que, los pacientes asegurarse de que las notas y la información de los pacientes estén al día y contestar el teléfono. Especialización. Como los doctores, los enfermeros también pueden especializarse. Una partera se ha especializado desde el inicio en haciendo cursos en partería, que es el manejo del embarazo y el parto, dar a luz. En enfermeras distritales, visitan a los pacientes en sus casas, y visitadores de salud también trabajan en la comunidad dando consejos en la promoción de la salud y la prevención de enfermedades. D, the nurse's role. The nurse's role has changed considerably in recent years. In addition to general patient care, checking temperatures, pulse rates, and blood pressures, changing dressings, giving injections, and removing sutures, nurses now do some of the things previously reserved for doctors, such as prescribing drugs and ordering laboratory tests. More responsibility for nurses is planned, as the following article demonstrates. Nurses carry out surgery in effort to cut patient waiting lists. Nurses in Scotland trained to perform minor surgery have entered the operating theatre for the first time in an effort to cut patient waiting times. 5 nurses who have passed a new course at Glasgow Caledonian University are now qualified to carry out such procedures as the removal of small lesions, benign moles, and cysts. The verbs perform and carry out are used with all types of procedures. They are often used in the passive form. Perform or carry out an examination, an operation, a procedure, an experiment, a test, and a biopsy. The procedure was performed or carried out by a nurse. D. El rol de las enfermeras. El rol de las enfermeras ha cambiado considerablemente en los años recientes. Además del cuidado general de los pacientes, chequear temperaturas, el pulso, la presión sanguínea, cambiar la ropa, dar inyecciones y remover suturas, las enfermeras ahora hacen cosas que que antiguamente eran reservadas solamente para los doctores, como recetar o prescribir medicamentos y ordenar exámenes de laboratorio. Las mayores responsabilidades de un enfermero están planeadas como el artículo siguiente lo demuestra. Las enfermeras llevan a cabo o realizan cirugía para así acortar el tiempo de espera de los pacientes. Enfermeras en Scotland entrenan para llevar a cabo cirugías menores. Han entrado al esquema de operación por la primera vez con la ilusión de cortar el tiempo de espera de los pacientes. 5 enfermeras que han pasado al nuevo curso en la Universidad de Glasgow están ahora calificadas para llevar a cabo procedimientos como remover lesiones menores, lunares o verrugas benignas y quistes. Los verbos realizar y llevar a cabo son usados con todo tipo de procedimientos. Ellos usualmente se usan en la forma pasiva. Por ejemplo, realizar o llevar a cabo un examen, una operación, un procedimiento, un experimento, un examen o una biopsia. El procedimiento fue realizado o llevado a cabo por una enfermera. Okay, the exercise from these chapters. Okay, 7.1, complete the sentences. Someone who specializes in delivering babies is a midwife. Someone who is qualified to assist nurses is a clinical support worker. Someone who is not qualified but is able to assist nurses is a nursing auxiliary. A nurse who has qualified is a staff nurse. A nurse who specializes in health promotion is a health visitor. A nurse who looks after a ward is a charge nurse. A nurse who works in the community is a district nurse. And someone who answers the ward telephone is a ward clerk. 7.2, make word combinations using a word or phrase from each box. Look at the opposite to help you. Carry out a procedure, change a dressing, check the temperature, give an injection, and remove sutures. 7.3, complete the sentences with the correct grammatical form of perform. An isotopy brain scan is painless and easy to perform. Biopsy of the pancreas was performed last March. If the patient's condition deteriorates, a laparotomy should be performed. If a diagnosis of meningitis is suspected, a lumbar puncture must be performed. Last year, we performed a randomized double-blind group study. 7.4. Complete the sentences with the correct grammatical form of carry out. I now intend to carry out a larger study. Unfortunately, few properly controlled trials have been carried out so far. A number of studies have been carried out recently to look at this question. A right hemicolectomy has been carried out and the patient made a full recovery. This procedure can be carried out in the emergency department. Okay, chapter number 8, Allied Health Professionals. A, community health. The health of the community depends on a large number of people under the medical practitioners and nurses. This can be grouped under the heading of allied health professionals. They include the following. Physiotherapists or physios help people to move by getting them to do exercises or by treating their body with heat or massage. Massage is treatment by manipulating muscles and joints with the hands. Occupational therapists, OTs, help people with a disability to perform tasks at home and at work. A disability is a physical or mental condition that makes it difficult to live normally. For example, blindness or deafness. Social workers help people to solve their social problems, for example, poor housing or unemployment or family problems. Chiropractors, also known as podiatrists, treat conditions affecting the feet. B, technicians. There are numerous technicians, people who work with scientific equipment, such as radiographers, who are known as X-ray technicians. Ambulance technicians work in the emergency medicine service. An ambulance technician with more advanced qualifications is called a paramedic. Capítulo 8. Profesionales aliados de la salud. A. Salud de la comunidad. La salud de la comunidad depende en un gran número de personas, además de los doctores y de las enfermeras. Eso pueden ser agrupado debajo del título Profesionales aliados de la salud, que incluyen lo siguiente. Fisioterapeutas, fisios, ayudan a las personas a moverse, dándoles ejercicio o poniéndolos a hacer ejercicios o tratando su cuerpo con calor o masaje. Un masaje es un tratamiento que se lleva a cabo manipulando los músculos y las articulaciones con las manos. Terapeutas ocupacionales. Ellos ayudan a las personas con una discapacidad para realizar tareas en la casa o en el trabajo. Una discapacidad es una condición física o mental que hace difícil vivir normalmente, por ejemplo, la ceguera y la sordera. Trabajadores sociales ayudan a las personas a resolver sus problemas sociales, por ejemplo, pobreza o cuando no tienen suficiente dinero para pagar la renta, y desempleo o problemas familiares. Y los podólogos tratan condiciones que afectan los pies. Técnicos. Hay varios técnicos que son personas que trabajan con equipos científicos, como los radiógrafos, que son conocidos como técnicos en rayos X. Los técnicos de ambulancia trabajan en el servicio de emergencia médica. Un técnico en ambulancia que tiene cualidades que está mayormente avanzado, que está más preparado, es llamado un paramédico. Ok, sí. Prosthetist and orthotist. Okay, prosthetists and orthotists provide care for anyone who needs an artificial limb, a prosthesis. Okay, a prosthesis, or a device to support or control part of the body, an orthosis. They also advise on rehabilitation, helping patients return to normal life and work after treatment. Prosthetists provide artificial replacement for patients who have had an amputation or were born without a limb. And orthotists provide a range of splints and other devices to aid movement, correct deformity from abnormal development of part of the body, for example, club foot, tallips, and relieve pain. D. Opticians. Opticians test eyesight and prescribe glasses, also known as spectacles, and contact lenses when necessary. The examination includes measuring intraocular pressure, the pressure of fluid inside the eye, and examining the retina. If the optician suspects an eye disease such as glaucoma, they refer the patient to their GP for treatment. The general practitioner may then refer the patient to an ophthalmologist, a doctor who specializes in diseases of the eye. Ok, entonces esto es prostecistas y ordecistas ortopedas. Estos proveen cuidado para cualquiera que necesite una extremidad artificial, una prótesis o un dispositivo para ayudar a controlar alguna parte del cuerpo. Ellos también dan consejos o ayudan en la rehabilitación, que es ayudar al paciente a volver a su vida normal y de trabajo luego del tratamiento o después del tratamiento. Los protecistas proveen reemplazos artificiales para pacientes que han tenido una amputación o que nacieron sin una extremidad. Los ortopedas, ortesistas, proveen férulas y otros dispositivos para ayudar con el movimiento, corregir deformidad de un desarrollo abnormal de una parte del cuerpo, por ejemplo, el pie equinóvaro, y aliviar el dolor. Entonces, los ópticos, estos hacen exámenes de la vista y prescriben o recetan lentes, también conocidos como espectacles, y lentes de contacto cuando es necesario. El examen incluye la medición de la presión intraocular, que es la presión del fluido interno del ojo, y un examen de la retina. Si el óptico sospecha de una enfermedad del ojo, como la glaucoma, ellos refieren al paciente a un doctor general para tratamiento. Si el doctor general podría referir al paciente a un oftalmólogo, que es el doctor que se especializa en enfermedades del ojo. Okay, exercises from this chapter 8. 8.1. Make word combinations using a word from each class. Ambulance technician, artificial limb, club foot, contact lens, health professional, intraocular pressure, occupational therapist, and social worker. 8.2. Which allied health professionals could best help the following people? Number 1, a young unmarried woman who has just had a baby. That's a social worker. A woman who is having difficulty using her right arm following a fracture. Physiotherapist. Someone who needs glasses, optician. An elderly woman who has had a below knee amputation. Prosthesis. A man whose wife has Alzheimer's disease, social worker. And a man with a fungal infection on his feet, podiatrist. And 8.3, complete the text, look at A and see opposite to help you. A prosterist works with patients of all ages as a member of a clinical team based at a large hospital. The patients may need a prosthesis as the result of an accident or amputation following a disease such as diabetes. Alternatively, they may have been born with a limb without a limb. Or orthorists work alongside doctors, nurses, physiotherapists, and occupational therapists to give the people under their care the best possible rehabilitation. Their main aim is to enable the patient to lead a normal life at work and leisure. An orthorist often works in a clinic as part of an outpatient service and also visits other centers to provide a service for people with special needs. They deal with people of all ages. For instance, children who have cerebral palsy may require splints to help them walk, and many older people need special shoes to correct deformity. If damaged, any part of the human skeleton may require some form of orthorist. And the orthorist may need to reposition the body or to relieve pain. Okay, the other chapter is chapter number 9, hospitals. A, introduction to a hospital. Jordi Pons is a fourth-year medical student from Barcelona. He has come to Britain on an elective attachment to the Royal Infirmary, Edinburgh. Dr. Barron is introducing him to the hospital. Dr. Barron says, the Royal Infirmary is the name of the university hospital for Edinburgh University. It is a general hospital dealing with all types of patients and illnesses, except pediatrics. We have a specialist hospital for that in another part of Edinburgh, the Hospital for Sick Children. You can see some of the departments in our hospital on this sign. And welcome to the Royal Infirmary. South entrance, Karen Parks, C&D, visitors and staff. The Simpson Center. The Simpson Center for Reproductive Health. Gynecology emergency, maternity emergency, neonatology emergency, outpatient departments or wards, day surgery unit, endoscopy, X-ray department, and combined assessment. Of course, there are many others, for example, the intensive care unit, ICU, and the surgical high dependency unit, HDU. Jordi says, what does outpatient mean? Dr. Barron says, outpatient are the people who come to hospital to attend a clinic or to have tests or treatment and then return home on the same day. Inpatients stay in the hospital for 1 or more days. The rooms where they stay are called wards. If a patient's treatment requires only 1 day, such as a simple operation, they can be admitted to the day surgery unit. Okay, capítulo 9, hospitales. Introducción a un hospital. Jordi Pons es un estudiante de medicina de 4º año de Barcelona. Él ha venido a Gran Bretaña en un intercambio al Infirmary Royal de Edinburgh. Doctor Barron le da dando la bienvenida, lo está introduciendo al hospital. Doctor Barron dice, el The Royal Infirmary es el nombre del hospital de la Universidad de Edinburgh, de la Universidad de Edinburgh. Es un hospital general, lidiando con todo tipo de enfermedades y pacientes, excepto pediátricos. Nosotros tenemos un hospital especial para eso en otra parte de Edinburgh, que es el hospital para niños enfermos. Tú puedes ver algunos de los departamentos en nuestro hospital en el letrero. El letrero dice, bienvenidos al Royal Infirmary, entrada del sur, parqueos para visitantes y personal, en el centro de Simpson para la salud reproductiva, ginecología, emergencia en maternidad, emergencia en neonatología, en departamentos de pacientes ambulatorios, todas las salas, unidad de cirugía para un día y endoscopía, departamento de rayos X y evaluaciones combinadas. Ok. Obviamente, hay muchos otros departamentos, por ejemplo, la unidad de cuidados intensivos y la unidad de alta dependencia quirúrgica. Jordi pregunta, ¿qué significa un paciente ambulatorio? Los pacientes ambulatorios son aquellas personas que vienen al hospital solo a atender clínica, a recibir una consulta o hacerse exámenes o tratamiento y ellos regresan a sus casas el mismo día. Y los pacientes hospitalizados se quedan en el hospital por 1 o más días. Las habitaciones donde ellos se quedan son llamadas salas. Si el tratamiento de un paciente requiere solo un día, como una operación simple, ellos pueden ser admitidos a la unidad de cirugía de un día. Ok, B, outpatients. Dr. Barron. The Accident and Emergency Department, A&E, also called casualty, is where patients who are acutely ill with a sudden serious condition come for assessment and treatment. Outpatients who have an appointment to see a specialist go to a clinic in one of the outpatient departments, OPDs. They have usually been referred to the hospital by their GP, who writes a referral letter to the consultant explaining the patient's problem. C, inpatients. Dr. Barron says, the inpatients in a hospital are admitted in one of 3 main ways. They may be seen in one of the outpatient clinics and admitted from there, or if there is a lot of demand for the treatment they need, as in the case of a hip replacement, they are put on a waiting list. They are put on a waiting list for admission. Alternatively, their GP may arrange the admission by telephone because they are acutely ill. For example, with suspected myocardial infarction, or they are seen in the A&D department where the doctor on duty working at that time arranges the admission. This would happen in the case of a patient with a fractured neck or femur. For example, larger hospitals may have an assessment unit where patients can be admitted temporarily while their condition is assessed. Jordi asked, evaluado, assessed, el doctor Barron. Dr. Jordi asked, assessed. Dr. Barron says, yes, decisions are made about their condition and what needs to be done to help them. After treatment is completed, the patient is discharged back to the GP's care. Ok, B. pacientes ambulatorios. El Departamento de Accidente y Emergencia, también llamado Casualty, es uno de los pacientes que están severamente enfermos, gravemente enfermos, con una condición repentina y seria, vienen a evaluarse, vienen por evaluación o tratamiento. Los pacientes ambulatorios que tienen una cita, para ver a un especialista, van a la clínica o a la sala en uno de los departamentos de pacientes ambulatorios. Ellos usualmente han sido referidos al hospital por su doctor o médico general, quien escribe una carta de referencia a su especialista explicando el problema del paciente. C. Eh, Pacientes hospitalizados. Los pacientes hospitalizados en un hospital son admitidos en una de estas tres formas. Ellos ellos son vistos en una de las clínicas de pacientes ambulatorios y admitidos después. Y admitidos después de eso. Si ellos tienen mucha demanda en el tratamiento que necesitan, por ejemplo, el reemplazo de una cadera, ellos son puestos en una lista de espera para admisión. Alternativamente, el médico general autoriza una admisión por teléfono porque ellos están extremadamente enfermos. Por ejemplo, cuando se sospecha de un infarto al miocardio, o ellos son vistos en el departamento de accidente y emergencia, donde el doctor que está trabajando en ese momento autoriza la admisión. Esto pasaría o podría pasar en el caso de un paciente con una fractura de cuello o fémur, por ejemplo. Hospitales más grandes o largos tienen una unidad de evaluación donde los pacientes pueden ser admitidos temporalmente mientras su condición es evaluada. Evaluada, sí, y las decisiones son tomadas dependiendo de su condición y lo que se necesita hacer para ayudarlos. Después que el tratamiento es completado, el paciente es mandado de vuelta al cuidado del médico general. And the exercises from this chapter. 9.1. Complete the table with words from A, B, and C opposite. Okay, admit, admission. Assess, assessment. Discharge, discharge. Operate, operation. Prefer, referral. Treat, treatment. Make word combinations using a word from each box. Acute, ill. Assessment unit. On duty. Referral letter and waiting list. 9.3. Which hospital departments will be most appropriate for the following patients? A woman in diabetic coma, intensive care unit or assessment unit. A patient who has just had a medical prostatectomy, high dependency unit. A patient who is to have a skin lesion removed, day surgery unit. A man with a foreign body in his eye, foreign body. Accident and emergency, and a woman with a threatened abortion. Gynecology emergency. 9.4. Complete the extract from an information leaflet. Leaflet for patients. Information for outpatients. When you arrive at the hospital, please tell the receptionist who will welcome you, check your details, and direct you to the waiting area. The length of your visit will depend on the treatment you are going to have. You may need to have some tests, such as an X-ray, which could mean going to another department. or you may be referred to other professionals, such as physiotherapists or dietitian. You may need to revisit the clinic. If a staff at the clinic want to see you again, another appointment will be arranged for you. If you need to be admitted to hospital for more treatment, either as an inpatient or for day surgery, you will be told when this is likely to happen. If you don't need further treatment, you will be discharged to your GP's care. And we are going to continue in another video.